Hello, I'm going to continue some very important pharmacy law. This is just for patient information. Good to know this information when you have a prescription, get it filled at the pharmacy. So the last time I talked about Schedule 2, Schedule 3, and Schedule 4 controlled substances prescriptions. Now, Schedule 5 controlled substance prescriptions or C5 prescriptions. Again, you need to understand the day supply on the prescription. So, no federal or state law regulating the quantity of this prescription, C5 prescription, or Schedule 5 controlled substance prescription. So, and no law uh, saying, how many they supply might be anything feeling, but any one time. Um, for the refill, um, no specific or set time limitation. So, um, for the C5 prescription, the law doesn't say um, how many days supply can be refilled. It's not like C free and C prescription. It limited 30-day supplies. So, but many states, may limit refills of C5 prescription to 5 refills within a 6-month period. It's like C3 and C4. C3 and C4 it limits to 5 refills within 6-month period. So it depends on where you live. Your state may want set the limit, set the time limitation C5 prescription. The C5 prescription may uh, be partial fill. So there is no law regulating the partial fill for C5 prescription. But the total amount of all partial filling but not exceed the total amounts required. And when the prescription is expired, it's no specific or set time for expiration. Um, so many states consider the C5 prescription is similar to C3 and C4 C3 and C4 prescriptions. Then the prescription might be just valid for up to 6 months from the day it was issued. So it still depends on your states. Okay. But if if your stay had no specific or set time for expiration, then the prescription may be valid for 1 year. Because most of the insurance company uh, and the pharmacy system is set up for 1 year cut off for prescription. Just another word, the prescriptions become invalid after 1 year which were issued. So this is very uh, important information for you as the patient understand, why they give you certain day supply, and usually for for those they who have no um, regulation on the C5 prescription, then they might fill up to 90 days supply. Now it's just like regular prescription uh, medication, so it can be due to 90 days supply. But if it uh, consider C5 prescription as the C3 and C4, then it might only give you 30 days supply. And again, check your state regulation to see um, if you can refill the prescription uh, beyond 6 month period. And most of the prescription is not valid after 1 year. Those very important limitation of the prescription. Please let me know if you have any question for the Schedule 5 controlled substances prescription or C5 prescription. Thank you. So the last part of this type of pharmacy law is the prescription only prescription, the RX only prescription, or some state is they say a C6 or Schedule 6 controlled substance prescription, either RX only prescription or Schedule 6 controlled substance prescription. So the day supply, so no law um, talking about the quantity may be dispensed at any single filling. So most of the insurance limit for 90-day supply. For people who travel overseas or something like that, might request 6 months supply. But like I say, most insurance companies limit for 90 days supply. for the prescription only medication. And then some medication, it's very dangerous to dispense over 3 months supply, like over 90 days supply. Medication like antidepressant or antipsychotic. Those medication they might limit to 90-day supply maximum. Like medication like Seroquel or uh, Lexapro or some medication require to monitor your blood like Coumadin or warfarin. Those medication they may not give you more than 90-day supply. That is the basic safety, not about insurance. It's not about the money. That is the safety. Most of pharmacists or the doctor they don't feel comfortable. They are not comfortable to dispense more than 95. For the refill, yeah, there's no specific or set time limitation, but many insurance companies and pharmacy systems set for 1 year. After 1 year, you probably need to get a new prescription, or the pharmacy folks they may call your doctor office to get a prescription renewed. Partial field is permitted. I know. However, the total amount or quantity in all partial fillings must not exceed the total amounts prescribed per, per prescription. So when the prescriptions expire, I just say valid for up to 1 year from the days were issued uh, from many insurance companies and pharmacy systems. No transfer of refill for the prescription only beyond 1 year from the day of issuance of the original prescription. So, uh, the pharmacy cannot transfer your refill to a different pharmacy if the prescription beyond 1 year. So after 1 year, most of the prescription is invalid uh, per uh, insurance companies or pharmacy system. Um, you may ask a new pharmacy call your doctor to get a new prescription or get the prescription renewed. That's all you can do. That the old pharmacy cannot transfer your expired prescription, you know, to a new pharmacy. So this is very important information for you as a patient to understand how the pharmacy fill your prescription at local pharmacy. You know, when they get your prescription, they look at the day of the prescription were issued, and then the day supply, the prescriber or the doctor one, and then some prescription, yeah, they like some uh, chronic disease, you might request 90-day supply, like high blood pressure or diabetes, uh, high cholesterol, those those medical conditions, it chronic medical condition, it requires you to take for a long time, then you might request 90-day supply for your convenience. Then most of the pharmacists accept that request from you. Um, you don't have to ask your doctor for that. You can ask the pharmacy to fill a 90-day supply as your request. And then you should know the most of the prescription is invalid or expired after 1 year. Then probably you need to get a refill before that. Otherwise, you need to have the pharmacist call your doctor office to get the prescription renewed. Some medication require you to see your doctor before they can renew. Most of the medication, treating your mental health condition like depression or anxiety or uh, the uh, the psych the psycho problems, and and you need to see the psychiatrist before you get the prescription review. Or some medication require to monitor your blood, like coumadin, need to get the lab blood test draw before they can renew your prescription. Things like that. You need to work with your doctor. The pharmacy cannot help you with those things. Um, and within 1 year limit, the pharmacy can transfer your refill to a new pharmacy. For example, you got prescription with 11 refills, and then the prescription after 6 months uh, of the day of insurance of the original prescription, then the pharmacist can call to a new pharmacy to get the prescription transfer. But after 1 year, they cannot do that. The prescription is no longer valid in their pharmacy system. I think most of the pharmacy uh, set the 1 year cut off for the prescription only medication. All right, so that's all about the prescriptions. From C2, C3, C4, C5, and C6 prescription. And C6 prescription is the regular prescription or the RX only prescription. Each state they call different. And so um, you may have to check with your pharmacy, your local pharmacy, to see how they call the Schedule 6 controlled substance prescription. Sometimes they call uh, the RX only prescription. Sometimes they call uh, Schedule 6 prescription or regular prescription. If you have any further question or any concern, please let me know. Uh, I'm willing to explain pharmacy law. If you confused or if you don't understand anything about pharmacy, please let me know. Want to clarify or make sure give you the good information that can help you understand why the pharmacy give your medication, why sometimes they don't. They review your prescription. Thank you. Have a good one.